Here is something I want you to remember. Women still die today from postpartum hemorrhage. Every nurse who has taken care of a postpartum woman has been shocked to find a woman that seems perfectly healthy and fine, that has little blood on her perineal pad, but she's bled volumes that have overflowed onto the chucks underneath her and has pooled under her back where the unsuspecting nurse wasn't looking for it. We have felt a boggy or a squishy fundus in a woman who was contracting so nicely an hour ago. It takes vigilance to take care of these ladies, and your CNA is a good partner who will help you a lot if you use her wisely. Here is a fact. A firmly contracted uterus in the immediate postpartum is a wonderful thing. A soft, boggy is the word we use, uterus, is bleeding. If it's not hard and firm, it's bleeding. Probably bleeding like crazy. When I was learning to be a midwife, I was supposed to be taking care of an early postpartum lady. She didn't like her uterus being massaged because it hurts so much since it's sore from so much recent exertion. So I very gently massaged her fundus, and though I didn't know it, I wasn't doing her any good. My instructor came in and felt the uterus through the abdominal wall. "Dina," she said, "look at this." I looked. She leaned, all 300 pounds of her, right onto the woman's uterus while the woman groaned and moaned in agony, and out onto the peripad popped a clot the size of a softball. The woman had been bleeding the entire time. The blood had been collecting in the uterus and forming a clot large enough that the uterus couldn't contract well around it. To massage a uterus, you have to put your hand just over the symphysis pubis, pressing just anterior to it to prevent the uterus from inverting. Then with your left hand, you find the fundus, massaging it, pushing it with as much pressure as is necessary to make it contract, pushing it toward the symphysis pubis. Essentially, you have the uterus between your hands. Nowadays, we usually give Pitocin IM or IV after the placenta is out, and that keeps it fairly well contracted. It doesn't always work. And then we depend heavily on good old-fashioned uterine massage. We do have a secret weapon, however, that helps mom, baby, and the nurse, and that is breastfeeding. Breastfeeding, particularly the infant suckling, stimulates the nipples, which causes a surge of oxytocin from the posterior pituitary. This works wonders in keeping the uterus contracted, but the effect wears off when the baby stops. Sometimes the baby doesn't want to nurse. Maybe he's too sleepy. Sometimes the Pitocin we administer seems to have no effect. Then we can give Methergine, Hemabate, or Cytotec if mom's BP is not too high. If it's too high, we cannot give those. Pitocin is the only one you can give in hypertension. But I have seen cases in which none of those worked. The only thing that kept the woman from bleeding out was bimanual pressure. A nurse with a long elbow-length glove makes a fist and inserts it as far as possible into the giant vagina, and with the other hand outside the abdomen, held the fundus and the uterus firmly against the fist. Uterus is compressed in between. The problem at that time was a piece of retained placenta in the uterus that wouldn't allow it to contract well. After it was removed, the uterus contracted nicely and the bleeding stopped. These things can happen so quickly. Postpartum nurses, as I said, have a sixth sense when it comes to detecting bleeding. You will learn a lot from them. If you get a quiet nurse that doesn't volunteer much information, then you be sure to ask a lot of questions.